You've just been told there is a nodule on your lung. Maybe it was found by chance on a scan done for something completely different. And now that word, nodule, is sitting in your head, and you've probably already typed it into Google at 2 in the morning. If that's you, please take a breath, because here is the most important things I will say in this entire video. The vast majority of lung nodules are not cancer. Stay with me for the next few minutes and I'll explain exactly what a nodule is, how we work out whether yours matters, and what happens next. Hello, I'm Marco Scarci. I'm a consultant thoracic surgeon in London. Chest and lung surgery, it's all I do. And I have this exact conversation with worried patients every single week. My job today is simple: to take the fear out of that scan report and replace it with a plan. What actually is a lung nodule? A lung nodule is simply a small, roughly rounded spot that shows up on a chest X-ray or on a CT scan. By definition, it measures 3 cm or less. As anything larger, we call it a mass. Most of the nodules I see are far smaller than that, a few millimeters, the size of a grain of rice or a pea. And that is an incredibly common finding. Roughly 1 in 3 chest CT scans pick up at least one small nodule. Modern scanners are so detailed that they now show us things we could never see before, including things that were always there and were never going to cause any harm. So, if they are not cancer, what are they? Well, most are scars from old chest infection you may not even remember having. Others are small patches of inflammation, tiny lymph glands inside the lung itself, or benign. That means non-cancerous growth. For small nodule, well over 90% turn out to be completely harmless. And for the very smallest one, under about 5 mm, the chance of cancer is less than 1 in 100. So most patients ask, why was mine found? Usually it's by accident. You had a scan for a chest pain or before an operation or after the fall, and the nodule simply came along for the ride. Doctors call this an incidental finding. Increasingly, nodules are also found through lung cancer screening. In England, the NHS Lung Health Check program invites people over 55 with a history of smoking to have a low-dose CT scan. Finding small nodule is exactly what the screening is designed to do. Because if one of them ever did turn out to be an early cancer, small is precisely how you want to catch it. So some patient always ask, is it cancer? How we actually tell? Here is the honest answer. From a single scan alone, in most cases, nobody can tell you for certain. What we can do is build up a picture. We are very good at it. We look at the size of the nodule. Bigger needs more attention. Also the shapes and the edges. Small, calcified nodules are usually benign, while irregular or spiky edges earn more scrutiny. The density is also important, whether it's solid or a hazy ground glass appearance. And then we look at you, your age, whether you ever been a smoker, your family history, and any previous cancer. But the most powerful test of all is time. Benign nodules behave themselves. They stay the same year after year. So for many small nodules, the right next step is a follow-up CT scan a few months later to see whether anything has changed. I want to pause on that because I know how it feels. Being told we'll rescan you in 3 months can sound like being fobbed off. It is not. Surveillance is an active, evidence-based plan. It's the safest, most accurate test we have for small nodule. And every year it spares thousands of people an operation they never needed. If a nodule is larger, growing, or looks suspicious, we have more tools. A PET CT scan shows how active the tissue is. A biopsy, a fine needle guided by CT or a camera passing into the airways, can take a tiny sample. And here in the UK, any nodule that needs more than routine follow-up is reviewed by a multidisciplinary team. That is a team made of radiologists, chest physicians, oncologists, and surgeons like me, all looking at your scan together and agreeing the safest plan for you. You're never resting on one person's opinion. If it does need to come out, sometimes the safest answer is to remove the nodule, either because the test points towards an early cancer or because removing it is the only way to be certain. If you do need surgery, it almost certainly isn't the operation you are imagining. The vast majority of nodules today are removed by keyhole surgery through a single small cut using a camera or with the assistance of a robot, which gives even finer precision. Depending on the nodule, we might remove a small wedge of the lung, a segment, or occasionally a full lobe. Often, the nodule is analyzed by the pathologist while you are still asleep, so everything is dealt with in a single operation. Recovery tends to surprise people. Most of my patients are out of bed the same day, home within 1 or 2 days, and back to most of their normal life within a few weeks. And the lung has a spare capacity. For most people, removing a small portion makes little difference to their day-to-day breathing. One more thing, and it matters. When a lung cancer is caught at the nodule stage, before it has spread, surgery offers a genuinely high chance of cure. That is the whole point of taking nodules seriously. A nodule found early, however, frighteningly, feels today and can turn out to be a stroke of luck. So what I want you to remember. If you remember nothing else, remember the following. 1. Most lung nodules are not cancer. 2. A follow-up scan is a real plan, not a brush off. 3. The details matter. Size, shape, growth, and your own history all change the picture, which is why Google can't give you an answer, but a specialist can. 4. If it ever is an early cancer, this is the best possible moment to find it. Lastly, write down your question before your appointment. Bring someone with you if it helps, and never be afraid for a second opinion. Any good doctor will welcome it. If you've been found to have a lung nodule and you would like a clear plan or a second opinion on a scan you already have, you'll find everything you need to reach my London clinics in the description below, along with my free patient guide to lung nodules, which answer the hundreds of questions I'm asked most often. If this video helped you, a like and a subscribe genuinely helps this explanation reach the patients who need them. Thank you for watching, and remember, a nodule is a question, not a diagnosis. Take care.